Hi everyone, my name is Catherine Hynes. I'm in Regis College's Pediatric Primary Care Nurse Practitioner program, and I'm going to introduce you to my pocket guide. This is my pocket guide. I started with a 3-ring binder. I have color coordinated tabs as a quick flip 2-page reference basically. So as we start, the very first page is the table of contents. In the table of contents, I have it broken down into sections as well as the corresponding pages to find the information on. So the first section, pediatrics, I have it divided into topics. So the bulk of my information will be pediatrics. Also included though, which is important, is pregnancy, the well woman, well adult, well elder, as well as a reference page. But again, the most information that I'll be focusing on is the pediatric population. So starting out, pediatrics. I divide it into age groups, office visits. Within a child's first year of life, we'll see these kids for their well visits at least half a dozen times. So this gives me a reference basically of when we expect to see these kids and when we'll see them back again. The next section breaks into during those wellness visits, what will we discuss? What things will we focus on? Throughout the entire pocket guide, there's lots of information on primary, secondary, and tertiary prevention. But again, during their wellness visits, key topics, ADLs, screenings, vaccinations, safety, and developmental milestones. The next page is a visual from the CDC's website. This is the CDC's recommended vaccination schedule. There's a lot of information here and I feel like it's a lot to memorize. So right up front, I wanted a reference page to go back to as I'm learning. So this covers birth up into 18 years old. And the next page is adulthood's recommended vaccination schedule. The next page is the visual of the growth charts. We'll be plotting these in primary care for every wellness visit. So their length, their weight, and their head circumference. I wanted to include these. There's the, let's see, this is birth to 36 months for boys and 2 to 20 years for girls. Again, I wanted to include these to be familiar with these, to be comfortable with them, to understand how to interpret them, and to be able to explain them to parents. As we go on, I break down the sections by age group. I start with newborn and I go on until adolescence. During the newborn section, this explains the newborn assessment as well as infant reflexes, nutrition. Things to point out with nutrition, I included a visual from the American Academy of Pediatrics, recommendations for formula-fed babies. This discusses from birth to 6 months how much formula to expect to feed them, how much, how frequent, how many feedings per day, as well as the total intake. This is not concrete, this is just a good reference. Also under nutrition, I feel like it's good to point out some key points that we teach parents that breastfed babies need vitamin D supplements, when to introduce fluoride. Also, how soon can you introduce peanuts to a child? How soon can a child be weaned onto cow's milk? Again, just good discussion topics. Also, going on sleep, I included a visual from the American Academy of Pediatrics, recommended amounts of sleep for pediatric patients, from infants all the way to teens, how many hours per day within 24 hours. Also, including naps. So again, not concrete information, but a good reference. Next, we go into developmental milestones, safety. A bulk of my pocket guide is focused in on safety. I feel like to raise and to care for pediatric patients, we're not only caring for their patient, we're teaching their parents. So a lot of these are good safety prompts for parents to be taught. There's a page dedicated alone just to SIDS preventions, key points that we need to teach parents, how to keep those babies safe to sleep at night. Also, car seat guidelines. This is a visual from the Buckle Up Boston campaign explaining based on a child's age, height, and weight which car seat they are which car seat they should fit to, basically, and which is the next one they would grow into, between a bucket car seat, a convertible car seat, a booster seat, and a seat belt. Next section, going into toddlers, talking about toilet training, nutrition. I kept a visual from the American Academy of Pediatrics, talking about food groups, how many servings per day, how many calories per day, and what those servings look like. The next page is an example of an autism screening form. This is called the M chart. This is the revised version. This is, again, just a screening form that we present to toddlers in primary care. Parents answer yes/no questions. It's not a diagnostic tool. It's meant to be, basically, it raises red flags for primary cares, providers, and parents to look into further. So there's that. Going on, it breaks it down into the preschool age child, the school age child, physical exam, developmental milestones, adolescence, early adolescence, middle adolescence, and late adolescence. The end of the back section of the pediatric part of this pocket guide goes into details and topics that I felt like were important to include that we see a lot of now. So diabetes in children, how do we diagnose it? What are the symptoms of it? How do we treat it? And how do we talk to parents about it? Asthma, another topic. Also included is short-acting, long-acting medications that we use to treat it. And childhood obesity, talking about the factors that contribute to it and how to prevent it. The next section is pregnancy. Pregnancy is divided into prenatal, intranatal, and postnatal, talking about prevention, how to care for these patients, their assessment, the physical exam, nutrition, exercise, and office visits. When do we see these patients? How many weeks gestation? What do we do at each visit? Breaking down physical changes and physiological changes of the first trimester, the second trimester, and the third trimester. And third. Going on, talking about the fetal well-being, discussing more details on ultrasounds, non-stress tests, and amniocentesis, some information on labor, breastfeeding, nutritional guidelines, and then going on to postpartum care. Another section I feel like it's good to point out is postpartum depression. The screening is done in the OB's office, postpartum. As well, it's another topic that I feel like now we're actually discussing it in the pediatric primary care appointments. The push is to catch this early and be able to treat these patients, to be able to help moms be healthy and take care of themselves. So I think we're finally doing a better job of it. So as we go on, the next section is the well woman, discussing the exam and primary and secondary and tertiary prevention, cervical cancer guidelines, and another thing to point out is the Gardasil update I included in this section. This is the latest update, how often it's given, and how soon it can be given now. The next section is the well adult, screening guidelines, cancer screening guidelines, and then information on selected populations. Also, nutrition, exercise, information on that, and immunizations and vaccinations. The last section is the well elder. Again, breaking down the geriatric evaluation and assessment. A big focus on mobility and function status, including information on falls and falls prevention. Cognition and depression, touching on that again. Another good thing to point out too is a medication evaluation, discussing things like polypharmacy and principles of safe prescribing. Nutrition as well, continence, and screening and tests and immunizations, primary, secondary. The last page is the reference page. Most of my information is from our assignments as well as our PowerPoints, but also included, especially with the pediatric stuff, I included a lot of information from the American Academy of Pediatrics and the CDC. So overall, I really enjoyed doing this project. I felt like it was a great way for me to take this information, process it, and create a reference for myself that I will be using in clinical and in classes to come. So thanks so much. I hope everyone has a great holiday, and we'll talk soon. Thanks.